Hey everybody, welcome to Pick Dr. Osborne's Brain. Got a great show for you tonight. We're going to be talking all about vision and eyesight and what you can do to improve upon it, support it, make it better, how to eat, and how to add nutrition to support great vision. So if you've got questions, make sure you go ahead and get those piped into the feed now. I'll do my best to get those answered for you as we go through the show tonight. And as always, if you're new to the show, say hi, let me know where you're tuning in from, and don't be shy. So let's dive in. Gluten and vision, and we're going to go even a little bit more deep into it than just gluten and vision, but I would be remiss to not talk about gluten as it relates to vision. So let's talk about first some of the diseases, some of the known conditions that gluten can cause. And so the first, and let's just be clear too, actually let's change that up. When I say gluten-induced eye disease, that doesn't mean that gluten is the only thing that can induce eye disease, nor does it mean that gluten is the only thing that can cause these different conditions. There certainly are other multiple factorial things that can go on here, but these are just diseases that we know gluten, again, can contribute to. And the first one's retinopathy. What does that mean? It's the retina. The retina is the back of the lining of the eye. It's where the light shines in through your pupil and hits the back of the eye. It's where vision is translated into the nerve, what's called the optic nerve to your brain. And so retinopathy is damage to the retina itself. Now, there's a lot of things that can cause retinopathy, but gluten is definitely one of them. And one of the big reasons has to be vitamin deficiencies. And we'll talk more about vitamin deficiencies as we get into tonight's show. So stay tuned and we'll talk about nutrients. But again, gluten causes vitamin deficiencies. These same vitamin deficiencies can lead to damage to the retina itself, aka retinopathy. Now, other things can cause retinopathy. Probably one of the most common that people don't actually realize is diabetes. With most of the time when you get diagnosed with diabetes, your doctor's, pumping the whole line about heart disease and heart disease risk and cardiovascular risk. But with diabetics, the greater risk is blindness. So you have, I think it's, if we're looking at statistically, you're 16 times more likely to go blind from a diabetic neuropathy versus heart disease, right? So you're much more likely to have damage to your eyes with that elevation in blood sugar. Now remember too, one of the things that gluten does is it contributes to elevations in blood sugar and diabetes and inflammation. So we've got multiple ways that gluten as a whole, vitamin deficiency, gluten-induced diabetic issues leading to retinopathy in the eye itself, also neuropathy of the eye, which is a different disease altogether. We'll talk about that shortly. But retinopathy, because of those elevations in blood sugar and the damage to the retina. And we have cataracts. I actually had somebody last week that was that I've been seeing now for a couple of months in the practice, and they went back to their eye doctor, and they were remarkably amazed at how much changing diet actually diminished and in part led to partial reversal of this individual's cataracts. And we know diet has huge impact and huge role to play with cataracts, and gluten one of those. Another is something called Pseudotumor Cerebri, which is a form of increased blood pressure in the cranium, and that affects the blood vessels feeding the eye, and this can lead to headaches, but it can also lead to eye damage. And so we know there are cases where gluten can induce one of the biggest things is vitamin A. Vitamin A deficiency has been linked to this. So vitamin A deficiency also been linked to retinopathy, so we can put vitamin A. As a matter of fact, vitamin A, you probably, if you grew up in my generation, you grew up with the Bugs Bunny, the rabbit eating the carrot, right? And carrots are always good for the eyesight, and that's because of the beta carotene. Beta carotene leads to production of vitamin A in your gut. If your gut's healthy, your gut will actually convert beta carotene from carrots and other carotenoids like the squashes. Anything really red or orange or yellow in your diet that's vegetable-based is rich in beta-carotene, and your gut's job is to convert that into vitamin A. Vitamin A plays a role here, plays a role here, plays a role here, and it plays a role with the retinopathy. So vitamin A, very, very important. A lot of problems can go wrong when vitamin A deficiency sets in. That's where gluten can really play a major role, because one of the things gluten does is it causes loss of fat absorption. Fat absorption in the GI tract itself. Now, remember that vitamin A is a fat. It's a type of fat. It's a fat-soluble vitamin. And so if you're, one of the tests that is used to kind of give doctors insight as to whether or not you might have a gluten issue is they measure fecal fat. And if your fat in your feces is really, really high, they suspect fat malabsorption. Subsequently, they suspect gluten-induced damage to the GI tract. So again, this plays a major role in creating that vitamin mineral deficiency component. But all of these, if you've been diagnosed with any of these things, retinopathy, cataracts, pseudotumor cerebri, or dry eye. Now this dry eye, we'll just make a subnote here. Sjogren's. Sjogren's disease is an autoimmune condition that damages the tear duct, the lacrimal gland, in your inner eye, so that tear production is diminished, and so now your eye dries out. We'll also see that vitamin A deficiency. So whereas this is gluten-induced autoimmune disease, so gluten-induced directly an autoimmune condition, but we'll also see corneal xerosis. What does that mean? The cornea itself dries up. Okay, corneal xerosis, meaning the cornea gets super dry. That's different than Sjogren's. Vitamin A deficiency causes corneal cirrhosis. Again, lots to do. Your eye needs vitamin A in so many different ways, from this aspect to the formation of cataracts, to the proper health and maintenance of the retina, to certain types of cells in the back of the eye that are required to help you see in the dark. There's an old adage, well, not adage, it's a name really, nyctalopia, which means night blindness. So if you've been driving and as you've gotten older, or you've got gluten issues, the longer that goes on, the longer your vitamin A levels are lower, the greater degree that's going to happen. That's that night blindness. You need vitamin A to form something called rhodopsin, which is a special type of protein in your eye that helps you see in dark. So when the light starts to dim or fade, you can still have that night vision to a certain extent. And if your vitamin A levels are low, you really start to notice a hindrance in your ability to see at night or to see in low light situations. Okay, moving on to, let's talk about some of the gluten-induced autoimmune conditions that affect the eye. So again, there's two kind of things to think about here. Let me back it up, because these are gluten-induced eye diseases. Typically through malnutrition, right, we get these types of problems. But this next category are autoimmune diseases that we know gluten can contribute to that will affect the eye. So think of this category as more indirect, whereas the other one was more direct, gluten-inducing malnutrition causing eye damage. This is more gluten causing an autoimmune disease that can contribute to, damage to the eye or dysfunction of the eye in some way. So there's several different types of autoimmune processes that can occur, but probably the biggest one is right here. It's thyroiditis. So if you've ever had a diagnosis of Graves', which Graves' is a form of hyperthyroidism. It's an autoimmune condition, but you could also have been diagnosed with Hashimoto's, and this is hypothyroidism. Both of these are autoimmune conditions. It's just that they behave differently. Whereas Graves', you're producing antibodies that mimic thyroid hormones, so it makes your thyroid overreactive. And Hashimoto's is when you're making antibodies that destroy your ability to make thyroid hormone, so your thyroid is underactive. In either one of those situations, you can get orbitopathies. One of the things that can happen is orbital myositis, which is where you start to see double vision because it's affecting the muscles in the eyes that help you focus, so we can get double vision. You can also get orbitopathy. If you've ever seen, particularly in Graves' disease, you see the big, it's called exophthalmia, but it's a bulging eye. So when the eyes are bulging out, almost looks like frogs' eyes, the way they bulge out of their head. The bulging eyes are kind of a hallmark or classic symptom of Graves' disease. So if that's happening to you and you've had that diagnosis, this is again one of the ways that gluten can induce an autoimmune condition that can impact your vision and impact your eyes. There's another situation or condition, or actually more than one, autoimmune disease, and that is Reiter's syndrome. And in the same family, with Reiter's syndrome, you also have diseases like psoriatic arthritis and another condition called ankylosing spondylitis. These are part of the family of autoimmune arthritides. So these are forms of arthritis that can also affect the eye. And it's a common manifestation in Reiter's particularly because it can affect your joints. It can affect the bladder, but it can also affect the eye. I actually one time I had a patient who came to see me. The doctor, she had uveitis, so her eyes were inflamed. She was getting ready to lose her sight. They were injecting steroids into her eyeball to tamper down the inflammation. And I've seen this happen in a number of cases. But in her case, it was a gluten-induced Reiter's disease, right? It was inflaming the eye to such an extent that the doctors were injecting steroids into the eyeball to mitigate the inflammation. Again, can't do that forever. Steroids are a bad deal. We'll talk about why in a minute. It's not that steroid can't be helpful once, but when you get into that habit of needing them repetitively over and over again, they have their side effects. They have their problems that come with it, including immunosuppression. But remember, this is a food. This is gluten, right? So we can change the diet and we can change the outcome of these arthritides, and then subsequently we can change the outcome of the secondary and tertiary effects of these arthritides, which is damage to the eye, to the uveitis, damage directly to the eye itself. So somebody was mentioning in the feed earlier, I saw this, they were talking about they had a genetic marker, or their son or their child had a genetic marker for this, and there is a genetic marker for this family of arthritides. It's called HLA-B27. So sometimes doctors will measure HLA-B27 in the blood. It's a genetic marker, and if it's positive, if you have HLA-B27 positivity, then you have an increased risk for the development of this family of conditions, and that's why a lot of doctors will measure that. Now, if you've ever heard me talk about the genetics of gluten, there's a similar gene as the HLA-DQ genes that we measure have to do with gluten sensitivity, and you notice HLA is the common theme here. HLA stands for human leukocyte antigen, and these are receptors or antennas that stick off of the surface of your white blood cells. And there are a number of genetic uniquenesses about these receptors that actually diet can influence in a good way, and that's a good thing, because if we didn't know how to change our diet, we would just be subject to the steroids, to the immunosuppressants, and the standard of care that medicine brings into the field of autoimmune disease. So uveitis, major side effect in terms of certain autoimmune conditions. And then brain and occipital calcification. There's certain autoimmune inflammatory diseases where we can get this problem, and if that happens around the cranial nerve, around your eye, your optic nerve, those blood vessels can get calcifications, and then you get reduced blood flow to the eye, and so over time that starts to impact and damage vision as well. So these are all potential for autoimmune disease that gluten can contribute to. And so again, the super takeaway here, the rich takeaway, is you can avoid gluten, right? To me, it would be far more painful to lose my ability to see than it would to be to change my diet. So some people, that's the way gluten impacts them, through the eyes. Okay, let's talk about some of the nutritional deficiencies that can impact the eyes. And I'm going to talk about some different categories here and walk you through some things. And we're going to add more to the board. So Gluten-induced nutritional deficiencies that can impact the eyes. There are a few on here, like vitamin C and vitamin E, that are super critical, more for their antioxidant function. And there are a lot of different antioxidants, but antioxidants help protect and preserve the function of the eye. And so it's important to understand that vitamin C, vitamin E, there's also some other things like astaxanthin, zeaxanthin. You'll see that zeaxanthin down here, but astaxanthin is another one. There are a number of plant-based phytonutrients or phytochemicals with very strong antioxidant properties that can protect the eye. And so we're talking about protection from the eye getting aged, presbyopia, aging eyes, right? As we get older, we tend to see a deterioration in our vision. Some people see that deterioration quicker than other people, and antioxidant status is a big reason why. And that's why it's important. I draw antioxidants on there because this can be measured. And in my opinion, if you're seeing a doctor, especially if you're seeing an eye doctor and he's telling you you've got presbyopia or you've got cataracts or you've got clouded lenses or whatever, you're probably because your antioxidant status is low. Now it can be measured, and then subsequently you can supplement to support your antioxidant status. You can also eat better to support your antioxidant status, but it's very, very important, critical for eye function. We've got beta carotene on this list, and beta carotene, as I mentioned earlier, beta carotene is important because it's a precursor to vitamin A. Now, beta carotene is also an antioxidant, so in that regard, it plays that role. But vitamin A is where it's at when it comes to eye health. It's one of the most important eye-related nutrients, as I've mentioned before. Vitamin A deficiency is linked to night blindness or nyctalopia. It's linked to cataract. It's linked to retinopathy. It's linked to damage along the sclera of the eyes. That's the white of your eyes. It can create a vitamin A deficiency, can lead to spots that form on your eyes called Beteau's spots. It's like a cluster of whitish yellow, almost looks like a little tumor on the eye, but it's a big spot, and that could be vitamin A deficiency. So if you look in the mirror and you've got that big white cluster there, that's something that might just resolve with some vitamin A supplementation. It takes 3 to 4 months of supplementation to start seeing correction in something like that. But beta carotene is a precursor to vitamin A. Most of the time, people don't get adequate vitamin A in their diet because they don't directly eat vitamin A. Where do we get vitamin A in the diet? Aside from converting carotenoids, one of the best sources of vitamin A is liver. Another really good source is eggs, the yolk, particularly the yolk of the egg, but liver and egg. Most of you probably don't eat liver, which is the absolute hands-down richest source of vitamin A. And if you're gluten sensitive and you have been for a number of years and you're just finding out, there's a strong likelihood you have vitamin A deficiency. I probably see this, again, this is a rough estimation, but in people that come to see me where we find them with gluten sensitivity, and about 10% of the people that come to see me have a vitamin A deficiency. So that's about 1 in 10. That's actually a pretty high number. It's not the most common deficiency with gluten sensitivity. It's not like zinc, for example. Zinc is present in 67% or so of people with gluten sensitivity. Vitamin D is much more common. Iron deficiency is much more common. But vitamin A, quite common. Now here's something else. So we got this next nutrient on the board, zinc. Zinc is super important for eye health because why? One, because it's an antioxidant. Zinc runs an antioxidant system called SOD. That stands for superoxide dismutase. It's a very critical antioxidant system. But just as important with zinc, zinc produces something called RBP. What is that? That's retinol binding protein. Now, retinol binding protein, what does it do? It's a protein that floats around in your blood. And so, if this is your bloodstream, you got RBP inside your blood, and it binds to vitamin A. And it carries vitamin A down your bloodstream, up through your circulation, carries it directly to your eyes. So think of it like this. Zinc Okay, step 1, we need zinc. Step 2, we form RBP. RBP binds to vitamin A, carries vitamin A to your eyes. Without zinc, this can't happen efficiently, and you can become vitamin A deficient even in the presence of plenty of vitamin A in your diet. And that's important to understand because, again, zinc is a carrier. It's the taxi cab that shuttles vitamin A to your eyes to give your eyes what they need in terms of that nutrient. So when you're out of zinc, you're out of the ability to adequately produce retinal binding protein. Now, one of the other things that can affect RBP, retinal binding protein, is too much sugar. You heard me talk earlier about diabetes, but diabetes, the sugar will do something called glycate. If you've ever heard me use that word before, glycate means it's like sugar. It coats and makes things sticky, right? Just like if you poured syrup on the floor, it'd make the whole floor sticky. Well, if you pour too much sugar, if you have too high of a blood sugar in your blood, you'll glycate, okay, the proteins in your blood. And one of them that gets glycated is retinal binding protein. And so that affects the way retinal binding protein can bind to vitamin A, so it makes it less effective. So elevations in blood sugar can affect your ability to deliver vitamin A to the eyes as well. So these are, again, why I've got this list of nutrients on here. They're so important. And then we have lutein and zeaxanthin, and these are very, very important. Research has been showing now for a number of years that degenerative eye diseases of age are actually, in many cases, I don't want to say reversed, but improved. We actually see people improving their vision if they get core antioxidants, and zeaxanthin and lutein are two of those that have been really well studied. So again, these ones are critical. There's a lot of great new research coming out on these, and a lot of new eye formulas are coming out with, you'll see that in many supplemental eye formulas, lutein and zeaxanthin. We also know that omega-3 fatty acids are important for eye function, and there's several reasons here. One of the biggest, though, has to do with the regulation of inflammation. We know that high levels or excessive levels of arachidonic acid, which is a type of fat, and also excessive levels of omega-6 creates an increase in the quantity of inflammation, and that's going to impact and affect the eyes. So that's one way we know omega-3 is important there. The other is through, this is one of your best natural, how do I want to put this? It's not a blood thinner, but it is in the sense that I'm gonna put it as blood thinner, but really it doesn't thin your blood. What it does is it maintains good thinness of your blood. Remember, omega-3 fats are an essential nutrient. They're essential, meaning your body can't survive or function without them. And a lot of people, like, they get a clot or they have a heart problem, their doctor wants to put them on blood thinners, or a lot of times doctors want to recommend aspirin because it thins the blood. But a lot of the time, these people don't need aspirin. What they need is an essential nutrient that naturally keeps their blood thin. Remember, it's very, very important for blood viscosity. The eyes have some of the smallest blood vessels in your body, and so that's why they're impacted the most. They're impacted because those really, really small surface area blood vessels are affected more when the blood is thick. They're affected more when there's too much sugar in the blood, causing an increased viscosity in the blood. So this is why the eyes are so impacted, why omega-3 is just so critical for normal, healthy eye function. We've got some other nutrients on here, and I will say this, copper, I'm drawing a lot of antioxidants here. Copper is also an antioxidant. It also helps zinc run the superoxide dismutase system. But there is a kind of trend between vitamin B12, folate, and copper, and that trend has to do with the myelin sheath, which is very, very important for eye function. Remember, your eye, if we kind of look at the back of your eye, let's make some room on the board here. So Okay, so if this is your eye, this is your optic nerve. And that optic nerve needs a coating. It needs insulation around it. And so a lot of times we'll see eye deterioration in individuals that have what's known as demyelinization. And so this optic nerve, remember, it transmits signals back and forth. So signals from the retina. The retina is actually this aspect, the back part of the eye. This is where the light, when the light comes in to the eye, it hits the retina, and that is transmitted into a neurological signal that then travels up the optic nerve into the brain, into the eye centers of the brain, where it's translated so that we can see. And if we have deficiencies in B12 and folate and copper, remember nerve function, neurological function, very, very critical, because these three nutrients help with that process. Then we can actually get deterioration of vision, neurological deterioration of the vision itself. So very, very important that we consider B12, folate, and copper on this list of eye nutrients. Now, there certainly are more nutrients we could add to this list. This is not, I don't want to call this the end-all be-all list of nutrients that are important for eye function, but some of the most critical here. Other ones, if we're really, I mentioned blood thinning earlier. One of the great ways to also naturally thin the blood is ginkgo biloba. It works really, really well to help support good blood viscosity. Bilberry is another very powerful antioxidant that's been shown in a number of research studies to benefit and aid the eye. We've also got nutrients like quercetin, which is a bioflavonoid with very potent antioxidant functions that help support eye function as well. So again, there are a lot of different nutrients that will help with this. Remember, if you're just kind of pot shot guessing, one of the most important things you can do is right here, is just making sure, if your eye doctor is telling you your vision is failing, ask them to measure your antioxidant status. If it's low, you want to consider some of these core antioxidants for the eye, like lutein, zeaxanthin, vitamin C, vitamin E, beta-carotene, zinc, copper, ginkgo, quercetin. You can use other antioxidants like bilberry. You can use alpha-lipoic acid. Alpha-lipoic acid is important here for the optic nerve preservation. We've seen this a lot in studies on diabetics who have eye damage and neurological damage as a result of elevations in blood sugar. Alpha-lipoic acid helps preserve the integrity of that nerve from the damage of blood sugar. So again, a lot of important nutrients for eye function. Those are the ones I wanted to cover with you tonight. And now let's open the floor up for any questions that you guys and gals have. All righty. Okay, Filene, perfect question, Filene. What vitamins, minerals are needed for vision that may not be being absorbed when celiac? So I mentioned vitamin A, also mentioned zinc. And again, if we're talking about the top 5, I just kind of perused through them, but vitamin D, iron, zinc, B12, and omega-3. I've got data, 20 years of clinical data. These are the top 5 nutrient deficiencies in individuals with gluten sensitivity who are gluten exposed, okay? Now beyond that, there are, I say these are the top 5. This is just statistically the top 5. I see it all over the map. When we test for people's nutritional levels, we looked at 40 different essential nutrients that you should be aware of. It's important if you're gluten sensitive or celiac that your doctor's measuring all of them, because it could be any one of these 5. It could be any one of some of these primary nutrients. It could be other ones as well. So don't think of it as just limiting yourself to testing only zinc or vitamin A, right? It's probably best to look at them all. Asita wants to know, any role for gluten or autoimmunity in visual snow? I'm not convinced brain activity abnormalities indicate the primary cause is the brain. I've seen cases where people saw visual disturbances, visual snow, eye floaters. all very, very common. And I've seen in every one of those different cases, I've seen those things go away. Clinically speaking, I haven't seen any research where you've got actual ophthalmologists or other eye doctors doing research studies on gluten sensitive or celiac patients to determine whether or not there's like a valid connection. But I can give you case report after case report where we've seen that happen. Can gluten cause digestive problems or constipation? Wow, that's hi Helena, that's a no-brainer, really. Glad you asked the question, but absolutely. I mean, gluten's notorious for causing both. I like this story. Nancy says, 2 years true gluten-free diet. I had many floaters, all gone. I see my ophthalmologist at the end of May. Can't wait for him to see the improvements of my eyes. I can't either. Make sure that you let him know what you changed, because hopefully that'll cue him in to helping maybe potentially help somebody else who's coming in and having a problem as well. Let's see. My son's telling me that ancient grains like einkorn won't hurt me and are actually good for me. Your son's wrong if you're gluten sensitive, Star. I mean, if you're gluten sensitive, einkorn, ancient grain or not, it's got gluten in it. It's going to damage you. So in that regard, if we're talking about gluten sensitivity, you wouldn't want to do that. Sue, I wake up at 3:30 with tingly fingers or achy upper arm. Can this be from gluten or dairy or milk? I am gluten sensitive but have not given up all other, I'm going to assume you mean grains yet. So if you're gluten sensitive and you're still getting grain in your diet, Sue, that's the absolute very first thing I would do. The other thing is, you're waking up at 3:30 with tingling fingers and an upper achy arm. Look at your sleep position. You know, some people when they sleep, you know, they're lying down like so, and their arms are bent, and the anatomy is different in everyone, but you've got nerves that run through. You've got what's called a cubital tunnel here. You've got your carpal tunnel down here, and some positions will cramp that nerve or compress that nerve, and you'll wake up in the middle of the night with tingling and achiness because the positioning, the physical anatomical positioning of the body. So that's a possibility too. And that being said, gluten and dairy have been shown to cause neuropathy and neurological damage, including carpal tunnel syndrome. So, that's something you definitely want to get your diet switched out and changed up, to be 100% true gluten-free. 6 bouts of iritis. Could it be gluten related? It could be, absolutely, not a doubt in my mind about it. So, proof is in the pudding. Can other things cause iritis? Sure they can. There's infectious microorganisms, there's chemical exposures. I mean, a lot of other things can affect the eyes. I've actually had patients allergic to, their contact lenses directly. I mean, some people are allergic to the ingredients that the lens that they're using is actually made out of. So creating a lot of eye inflammation, different types of inflammatory conditions of the eye, all because they were wearing a lens that they were reactive to. I've seen people be allergic to their compound, not to their compound, but to their eye solutions for their lenses. So the droppers they put in the eyes and the droppers that they clean their lenses with, they're actually allergic to, and then they're putting them in their eye directly. I've seen a lot of that. That's why it's such an important thing to do. If you've gone gluten-free and you really are doing the diet right, and I mean the true gluten-free diet, I'm not talking about the traditional gluten-free diet that it's not really all that good for you. And if you don't know what that means, go get a copy of No Grain, No Pain and read it, and come back to the show and you'll learn a lot more. But allergy response with chronic inflammation is very common, and so sometimes the allergy is to what you eat, and sometimes the allergy is to what you apply, what you put on, or what you put in your body. I've seen a little bit of all that mixed in together with different folks. Kathy, I think I may have addressed this, but she says her loved one has uveitis, and her labs show that she has gene markers for ankylosing spondylitis. So that's what I was referring to earlier, the HLA-B27 gene marker. And it doesn't mean you have ankylosing spondylitis. It means you have an increased risk for the development, or greater likelihood for the development of that particular condition, which is linked to uveitis as well. Gelin and xanthan gum. Dahlia wants to know, could I talk about gelin and xanthan gum on the intestinal tract of people with ulcerative colitis? Gelin gum, not much. I mean, gelin gum is, in my experience, is a relatively safe gum, although any gum for somebody with colitis, inflammation of the intestines, large or small, gums are hard to digest. Yeah, so gums for somebody with an active inflammatory bowel disorder should, in my opinion, should be left out of the diet, and that includes all gums. And that's, again, it's because gums are hard to digest, they're hard to break down, and your gut's inflamed and it's already struggling with the food, so you don't want to put more on it than what it can handle. Now, if your gut is not inflamed and you don't have an active inflammatory bowel disorder, gelin gum should be okay. Xanthan gum, on the other hand, is typically it's made from corn, so it's not one that I would recommend for folks. I'd recommend trying to avoid that at all costs, especially if you know you're gluten sensitive. Oh, I like this. So Craig says, hey, been gluten and grain and dairy free for about 4 weeks. Is it possible to get a sty in the eye along with mouth ulcers as a sort of withdrawal? Yes. It absolutely is, Christy, a possibility that gluten withdrawal can occur in that way. I've actually seen that. Less the sty and more the mouth ulcers. Remember, too, there's also a sty can be indicative of infection, as can mouth ulcers. So it's possible that going gluten-free for 4 weeks, but you also picked up an infection around the face, and it may have nothing to do with gluten. So both of those things could be true. It's probably a smart idea to follow up with your doc if it's really bothering you. Should people with inflammatory bowel disease avoid nightshades? No, but since we were just talking about uveitis and we were talking about uveitis, and we were also talking about HLA-B27. So that marker HLA-B27 I was referring to earlier, if you have that and you are positive for HLA-B27, it's best that you avoid nightshades because you're more likely to react to the solenoids, which are chemical compounds found in nightshades, if you have that positivity for HLA-B27. And this is why a lot of people with rheumatological disease will avoid nightshades. It's why nightshades are a common food group that are recommended people with autoimmune pain avoid. It's one of the reasons why we generalize and have people avoid the nightshades on the no grain, no pain diet as well. Let's see here. I have Hashimoto's and I believe it causes eye inflammation, also so painful, and the swelling causes pain. Yeah, Faith, that's exactly right. That's what I was talking about earlier in terms of the eye manifestations of hypothyroidism and hyperthyroidism. So how does having had cataract surgery impact potential retinopathy? It's not that having the surgery contributes to retinopathy unless you just had a really bad surgery job, or unless you have just a general consensus toward inflammation in your eye already, and then the surgery just sets up the stage for the healing post-surgical. Because remember, all surgeries, what are they? They're scheduled trauma. It's what they are. I mean, some surgeries are necessary and some are helpful, but at the end of the day, they're scheduled trauma. And if you do trauma to an already inflamed area, then you could potentiate and increase the inflammation in an area, running the risk for greater amounts of damage. It's one of the reasons why, if you're doing any kind of surgery at all, it's very important to be nutritionally supported on the front side of that surgery and on the back side of that surgery. And some of the best things you can do pre and post surgery, a couple of supplements I'll mention because, well, in my opinion, these are super critical. Let's change our color here. There we go. So if you're talking about before surgery, what your doctors don't want you to take are things that thin your blood. So that would be, so don't take, omega-3 fat and things like ginkgo, right? Ginkgo thins your blood, and aspirin, if you're an aspirin user, aspirin can thin your blood. So don't take those things right before your surgery. your doctor doesn't want your blood to be too thin where it creates a problem, okay? Now besides those things, what do we take to support the surgery and to support the recovery? In my opinion, one of the best things you can take is L-glutamine. Very, very helpful. I've got years of experience using that pre-surgically and post-surgically, as a matter of fact. So this is, pre. This L-glutamine before and after, in my experience, surgery and to support the recovery, really accelerates the healing. And when I was in the hospital doing nutrition, we would put our patients on glutamine, and we would see them heal 2-3 times faster than patients who weren't using the L-glutamine. So very, very helpful, very crucial amino acid for recovery. Other amino acids for recovery are the BCAAs. BCAAs, that stands for branched chain amino acids, valine, leucine, and isoleucine. These are all 4 of these amino acids, glutamine and the branched chain aminos, are important for the repair of the collagen structures that the doctor is going to cut through to get to wherever they're going to do that surgery. The other thing that I find is vitamin C. Very, in my opinion, it's non-negotiable. And vitamin C is, we're talking about pre and post, 5 grams to do that. So those are, again, just some real simple things. We could go into a long detailed list, but I think these cover both pre and post surgically. And if your surgery includes antibiotics, so if you were IV antibiotic, or if it was dental surgery and they wanted you on an antibiotic, in my opinion, you need to be on a strong probiotic to recoup from what the antibiotic is going to do to you. So you want to support your natural microbiome recovery with a good probiotic, and preferably, we're looking at about 85 plus billion CFUs, and that stands for colony forming units. That's just the quantity of probiotic. If most over-the-counter probiotics are in the millions, not in the billions, and so if you're under 85 billion, or if you're not in that neighborhood, it's like spitting on a forest fire. You're not going to do a whole lot of good. And then with L-glutamine, it's 2 to 3 grams per day, and this is best done on an empty stomach. The others doesn't matter, but glutamine really best done on an empty stomach. Branched chain amino acids, 4 to 5 grams a day. And again, this is pre and post, so coming up to the surgery 1 week before, and after the surgery a couple of weeks post-surgically. And just depending on how you're recovering, I sometimes will take people up to 6 weeks. So this is just what I do, within my practice, but these are strategies that we use nutritionally just to support that person's ability to heal and recover. So going back to, the question about eye surgery and an increased risk for inflammation, again, I know that's not exactly the question that was asked, but that's something I would recommend there. Itchy eyes and watery, what products would you recommend for that, and for how long? So if you've got watery, itchy eyes, Shanquilla, you probably have there's probably some kind of an allergy, and that could be air related, so airborne allergy, or it could be a food. I've seen this a lot, food responses creating watery, teary, itchy eyes. So in either case, so if it's food, obviously avoidance is the biggest thing that you can do, and that helps kind of navigate that. But if it's airborne, and let's say it's like oak pollen or ragweed or something like that, it's not much you can do. And what you're experiencing is most likely a histamine response. So if that's the case, that's what teary, watery, itchy eyes is generally. It's histamine. So there's a product I recommend called Aller-Ease. And, as a general rule of thumb, you take 4 caps a day. It's a pretty helpful. What it does is it's got things like quercetin and vitamin C and nettle, and it will help stabilize the mast cells. Those are the cells in your body that release histamine. It'll stabilize their membrane, and it will support a healthy histamine response, and it might give you some benefit in that regard. Okay, let's see here. Oh, yeah, there we go. How much vitamin A do you need? Okay, yeah, great question. Depends. If you're deficient in vitamin A, severely so, 25,000 IU for a couple of months should be enough to get you back on track. Now, here's Star. I'm going to caveat here. Do not do this unless you're being monitored. So, make sure you're being monitored by a doctor, because one of the things that can happen, with vitamins, it's very rare that any vitamin poses a risk for toxicity. Vitamin A can pose a risk for toxicity. That's actually quite rare. If you do this for 2 months, you're probably not going to run into an issue, but there are some different caveats where you'd have to be really careful. Let's say you have a liver condition. Okay, and your liver can't handle that metabolism effectively, and this works your liver too hard and it worsens your liver. This is why you want that to be monitored. Now, beyond that, you could go down to 12,000 units a day, and that's pretty safe to get a vitamin A deficiency corrected. Again, time frame would be probably pretty comparable in that regard, but if we're talking about pure vitamin A, we're not talking about carotenoids, because sometimes on supplements, you'll see this term, it'll say vitamin A as, and then it will say beta carotene or carotenoids or something along that route. And that's not vitamin A. This is pre-vitamin A. And if you have inflammatory bowel disease, or you have some other kind of gut problem where your gut's not working, your gut doesn't have the capacity to convert that carotenoid into vitamin A, and so that means that type or that supplement won't probably work for you. And a lot of times with inflammatory bowel disease, we have to use vitamin A if we're going to get it really, truly corrected. Let's see here. Does bee pollen contain gluten? No. It can be probably cross-contaminated with gluten depending on where it's manufactured, but no, as a general rule, bee pollen does not contain gluten. Can you please talk about SEERS? Seems you talk about chronic inflammatory response syndrome. Seems my mold. Yeah, I mean, Donna, that'll be a topic we've done some shows on mold. I would encourage you to go back. Maybe we can put some links up in the feed for you to go back and check those out. But it's too broad, it's too big of a topic to dive into tonight in the time we have left. But yeah, we can definitely talk about it. Thanks for the suggestion. So Dahlia says, I've heard that ulcerative colitis can progress to eye disease like uveitis. Why would this occur? Malnutrition, predominantly malnutrition. With any type of ulcerative colitis, Crohn's disease, celiac disease, inflammatory bowel disease, gastritis, what you run the risk of is malabsorption of vitamins and minerals, right? And so that vitamin mineral deficiency can cause eye disease. Can having hypothyroid cause problem with blurry vision or cloudy addition? Yes, it can. And I mentioned that earlier, but definitely hypothyroidism can cause clouded vision and blurry vision. Can gluten cause photophobia and light sensitivity? Yes, I've seen it. That is one of the things I've seen it cause. Now, more specifically, it's not the gluten necessarily per se that causes that. Gluten, it goes back to the nutritional deficiencies that gluten can contribute to, but gluten, particularly vitamin B2 deficiency, causes photophobia, which is sensitivity to bright lights. And so this is like, if you're this person, you're the one that's always in your shades, right? Future's so bright, you got to wear shades. Only future's not bright because you got a vitamin B2 deficiency. Okay, so if you're always in shades, you probably have photophobia. You might consider vitamin B2. Also, iron deficiency can do this as well. So the two, between B2 and iron, very common nutritional deficiencies associated with gluten that lead to that phobic component toward light. Oh man, the questions are everywhere. Let's see, vegans. No, that's not a question. Yeah, so I like that. So many people vitamin A deficient because you're right. They're vitamin A deficient because they're told to avoid saturated fats. So things like egg and the yolk, they're told to avoid that. They're told to avoid things like liver. Like there's a big component. There's a big kind of movement against beef and against animal-based products, and liver's one of those. And unfortunately, that movement is as popular as it is because I think it's to the detriment of most people. Is it possible to have falsely high numbers for hemoglobin A1C, minus 5.6, but I don't eat sugar, I eat low carb, zero grain, legumes, dairy, I do intermittent fasting? I don't get it. It is possible to have a false elevation in hemoglobin A1C. Hemoglobin A1C is not the end-all be-all to measuring blood sugar. And so on that note, if you're really curious about it, so hemoglobin A1C is a part, it's a piece of the puzzle. You also want your insulin, you want to measure your glucose, fasting glucose, as a part of what's happening here. This by itself, a lot of doctors have just gone because insurance pays for that test. So a lot of doctors have just gone to just measuring that. A lot like the way a lot of doctors have just gone to measuring TSH for measuring the entirety of the thyroid, which in my opinion is unfortunate. But insulin and glucose, C-peptide, which measures how well your pancreas is producing insulin. You want to look at pancreatic function. You can also measure certain nutrients are very critical for this. So like the biggest one here where you have false high hemoglobin A1C is chromium. If you're doing everything right, your chromium levels are probably too low. Show you a picture here. If this is your blood, and this is glucose floating in your blood. That glucose has to leave your blood to get into your cell to make ATP in your cell. So if this is a cell, right? But in order for that to happen, your pancreas has to produce insulin. And so it throws that insulin into your bloodstream, and then the insulin has to bind to an antenna on the surface of your cell called an insulin receptor. And so that binding is very, very critical to open a door that allows that glucose to come into the cell to make that ATP or that energy. So this insulin receptor, though, you can't make it if your chromium levels are too low. So a lot of times what will happen is people with low chromium will have a problem with blood sugar, even though they eat well, they exercise well. So, checking the chromium is very important. Also, the zinc is important. Zinc is the centerpiece that holds insulin together. Niacin helps chromium do its job to produce the insulin receptor. So there's certain nutrient deficiencies that even in the perfect diet, perfect exercise, if you have them, they'll cause a skewance upward of your hemoglobin A1C level, because good healthy hemoglobin A1C is really at 5 or less. And so I would agree with you that, in that range that you're in, that's probably a little bit too high. Let's see. Caffeine raises adrenal. I don't see a question in that. Is salmon a good source of vitamin A? Salmon liver and cod liver are great sources of vitamin A. What medical degree would I suggest for someone with a holistic view? I wouldn't, because if you get a medical degree, you're going to have the holistic beat out of you for 4 years. The doctors that I know that are medical doctors that come out of medical school, they practiced 15 years, found out that it was the way that medicine is practiced today doesn't really help people get better. It's not holistic, and that's why they went toward kind of more of a functional medicine, holistic view. But they didn't learn any of what they're currently doing in medical school. If you want to learn the opposite of, this is my opinion, if you want to learn the opposite of what to do with chronic degenerative inflammatory illness, then a medical degree is a perfect right up your alley. But if you want to learn the right things to do, you're not going to get that in medical school. So you've got to, that's postgraduate work, heavy postgraduate work, nutritional work, biochemistry work. Where can we naturally get copper from, or is it best to supplement? Both. You could get it from supplements, you could get it from food. Nuts are rich in copper, organ meats are rich in copper, oysters are rich in copper. We've got an entire show on copper if you want to go back and watch it. We talk really, really in depth if you want to learn more about that. Let's see. So myasthenia gravis is an autoimmune disease. We didn't really talk about that, but I'm glad you're bringing that up, Nancy. So what happens in myasthenia gravis is it can cause the eyes to droop, but it can also cause the eye muscles to get weak with time. I've seen a number of cases in my practice of myasthenia come to see me, and I've seen them go into remission. So myasthenia gravis is where you have an autoimmune condition against the acetylcholine, which is the main neurochemical that helps with muscles actually having a neurological message helping them contract or relax. So like in the case of the eyes, you'll get lid lag with myasthenia gravis. So the lids of the eyes will lag down because when you're awake, your eye muscles have to be actively on all the time to keep the eye. But with myasthenia gravis, this autoimmune effect deteriorates the ability of acetylcholine to stimulate the muscles of the lids to stay open, so they start to droop. We also start to get vision disruption, because one of the other aspects of vision is you have a couple different sets of muscles. You've got cranial nerves that feed the eyes and how they move, left, right, laterally, up, down, etc. But you've also got muscles that attach to the lens directly that help the lens contract and expand. And so those muscles can be affected with myasthenia gravis as well. So a lot of vision issues can crop up with myasthenia. My experience, gluten-free diet is a great place to start, Nancy, with that. Floaters in the eyes once in a while are not an issue, but if your eyes are chronically, floaters where you're having a hard time seeing, the honest truth is we don't know with 100% certainty, but what we think is those floaters are proteins, particularly they're glycated proteins. So they're proteins that are coated in sugar, and they're damaging your eye. So we see a lot of diabetics will report floaters, aggressive quantities of floaters, and this is why we change the diet, we change the glycation, we control the degree of floaters. A few here and there, not a big deal, but that chronic high level of floaters, that's a problem. Can gluten indirectly cause, what does that say, eye bags, even if we get enough sleep? Yes, it can. You have bags underneath the eyes. Bags underneath the eyes are oftentimes a sign of allergy, that puffiness, that swelling and edema in the eye itself, and that can be gluten. It can also be other food sensitivities. Oh, so somebody's asking about fat deposits in the eyes. There's different types of deposits. There's different types of fatty deposits that can occur in the eyes, and I've seen that be the case in people with choline deficiency, Nikki. Choline is like a B vitamin, and it helps the liver properly metabolize fat, but choline deficiency is common to cause fatty deposition, plaquages in the eye. There's also something called xanthelasmas. There's lipid formations around the eye that can occur in individuals who have fat metabolism issues. It's not necessarily a cholesterol thing, although many people try to blame it on that. It really has more to do with how your body's metabolizing fat. We'll also see lipomas, which are like little fatty tumors that form under the skin that can occur in these types of situations. How much vitamin D, E, and omega? It just depends. If you're not deficient in any of them, omega, I like to see people get with concentrations of EPA and DHA about 2 grams a day of omega-3 fatty acids. If you're talking about vitamin D in a day, just generalized supplementation. If you're not deficient, anywhere from 4,000 to 5,000 units is adequate. Now, some people may be dropping their jaws right now because they're thinking that's a super high mega dose. It's not. Vitamin E, depends, deficient or not, anywhere between 200 and 1,000 international units a day, again, depending on what your needs are. So my mom has macular degeneration. I'm gluten sensitive. How can I avoid my eyes getting macular degeneration? You take care of your eyes. The best way to take care of your eyes from a macular degeneration standpoint is antioxidants, hands down. Ultimately, we're all going to age. What we can try to do is age gracefully instead of aging aggressively, right? And that aging gracefully requires diligence. It requires good sleep, good diet. It requires sunshine. It requires the stress management. It requires clean air, clean water, the fundamentals of life. So Nikki's asking about testing for vitamins and minerals. We use multiple different technologies, but one of the primary technologies we use, and it's very critical to do this, is lymphocyte proliferation. It's called lymphocyte proliferation. And so if your doctor's not talking about lymphocyte proliferation, run the other way, because whatever they're going to be measuring is going to give you a lot of inaccuracy, and it's not going to be super helpful, in my opinion. I'm not sure I understand your question, Helena. Can nutrition help the deterioration of vision as a consequence of long-time screen exposure? You're talking about like cell phones, TVs, that kind of thing. It can. Remember what that screen time does is it's the wrong kind of light, right? It's that blue light basically wearing and tearing your eyes. The best thing you can do is reduce your screen time exposure and take care of your antioxidant status within your eyes directly. I recommend for that, Helena, I recommend a formula called Focus, F-O-C-U-S. It's a great antioxidant formula designed specifically for the eyes, and it can be very, very supportive and very effective at keeping that antioxidant status up in your eye. Let's see, go down on the right just a little bit. I love that. So somebody's saying Maggie's saying diet stabilized my wet macular degeneration. Have not had a shot in 3 years after needing shots for 4 years. Diet has relieved all arthritic joint issues and pain, and diet has reversed incontinence. High five to you, Maggie. That is fantastic. I love when you guys share those awesome stories of diet changing you. Somebody's asking if the doctor that I worked at when I was in the VA hospital in the rheumatology department, did the doctor ever throw pens at me? Yeah. As a matter of fact, he threw pens, he threw books, he was a pretty hot fella. He was a genuine caring person. I don't want to be too hard on him, but he had a temper. He definitely had a temper. Would I recommend a particular brand of vitamin A? Question coming in by New York. Yes, go to Gluten Free Society and check out Ultra A. Maybe we can plug that link into the feed for you here. Yeah, with vitamin A, again, I mentioned this earlier, Nancy. Don't take beta carotene if you want true vitamin A. If you want to have pre-vitamin A, that's beta carotene. But if you want true vitamin A, you've got to take something like a retinol palmitate. What I recommend for your husband's macular degeneration, which is not age related, I'd probably say the same general things, Dahlia. I would say get him on a good antioxidant, a formula like Focus. Make sure his diet is where it needs to be. Like those two are super critical. What kind of chromium? Polynicotinate. Chromium polynicotinate is one of the better forms of chromium to do that job. Is vasovagal syncope related to gluten and vitamin B deficiency? Yes, to both. It's also related to chronic aggressive stress of any kind. What can be done for eyelid droop? Depends on what's causing it. If it's like a facial palsy type of issue, which is one of the things we're seeing right now in a lot of these vaccines, people developing facial palsies. If it's a true like neurological damage, you've got to figure out where that's coming from. So that means testing. So it just depends on what's causing your droop. Does vitamin D cause kidney stones? No, it does not cause kidney stones. That's myth. As a matter of fact, vitamin D deficiency causes kidney stones. How does Reiter's syndrome affect the bladder? Since I was talking about it, it causes an autoimmune inflammation within the bladder, damaging the ureter, making it more difficult to pee. What do I recommend for rheumatoid arthritis? No grain, no pain. It's where it's at. I wrote that book based on 20 years of experience working with patients who have chronic autoimmune arthritis, and there's no better diet for autoimmune arthritis than there's no greater starting point than no grain, no pain. Do the vitamin supplements reverse the cataracts or just stabilize them from getting worse? I've seen both. I've actually seen cases where cataracts actually went away. I know that most doctors will tell you that's impossible. That's my experience. I can share that with you. Can you take quercetin long-term or just a few months at a time? You can take it long-term. Quercetin's pretty safe. I mean, you get quercetin in green tea and apples and berries. It's found in a number of different foods, and if you're supplementing with it, it's certainly okay to take over longer periods of time. There's no recorded detrimental side effects of using quercetin long-term that have ever been published, to my knowledge. Substitution of wheat flour by almond flour be an issue for hormonal system. Would it be better to use another gluten-free flour? It depends. I mean, some people are allergic to almond flour, and some people, the almond flour is high in omega-6 fatty acids, so it promotes an inflammatory process if you're using a lot of it. So I always say navigate gluten-free flours lightly when you're initially going gluten-free, simply because you want to kind of get away from that and get a feel for what your body feels like being away from gluten without all the other interjections. Let's see, scroll on that left side. Can fibromyalgia cause eye issues? Lately my eyes are blurry at times and dry. I would say if you have fibromyalgia and you have eye issues, it's probably not your fibromyalgia causing the eye issues. It's probably something else entirely, or something maybe nutritionally related. Nightshades. What are nightshades? Nightshades are a family of fruits and vegetables, but the classic nightshades are your potato, like your white potato, not sweet potato, but white potato. Also tomatoes, eggplants, peppers are part of the nightshade family. Goji berries are part of the nightshade family. Tobacco is part of the nightshade family. So those are your main nightshades. How much can someone's vision fluctuate with changes in diet? Can it wax and wane? It can. I mean, I've seen it change as dramatically as I had somebody after a couple months. They had to go back to their optometrist and be refitted for their glasses because they went backward 2 prescriptions, meaning their eyesight improved that dramatically. So, it just depends on the individual, and it depends on what the eye or the vision problem is, and if it's even nutritionally related, because there are vision problems that are not nutritionally related as well. Let's keep going down. Been through optic neuritis, high positive ANA, and no other antibody markers. I'm HLA-DQ8 positive. Could gluten have caused this? Yes, it probably did cause it. HLA-DQ8 is a gluten genotype. It's not only a celiac marker, but it's also it's a marker that's now being identified by some researchers as a primary marker involved with gluten-induced neurological damage. And so that's what optic neuritis is. It's the nerve to the eye becoming damaged. Scroll down more. Can colloidal silver help for allergies? If so, can nasal Versin be sprayed for? Colloidal silver is not going to do much for allergies. Colloidal silver is more kind of a natural antibiotic. Where can I watch this video from the beginning? Sylvia, subscribe. It's the best thing you can do. And on that note, any of you who are not subscribed, head on over to glutenfreesociety.org. About halfway down the page, it says subscribe to the world's #1 gluten-free newsletter. That's me, right? Subscribe there. That's how you can watch all of our videos. We have more than 1,000 hours of videos that you can watch absolutely free. We put live shows on weekly. So if you're new and you're not super familiar, but you're enjoying and getting value from tonight's show, you can tap in that way just by subscribing. Let's see here. We got to wrap this up. Can a gluten-free diet help with Parkinson's? Yes, but it also sometimes can't. So it depends on what's causing the Parkinson's. I've seen cases of Parkinson's dramatically improve with a gluten-free diet. I've also seen them not because there were other issues that weren't being detected or weren't being identified. A lot of times with Parkinson's, heavy metal, things like aluminum play a big role in my experience in the onset or the development of diseases like Parkinson's. So make sure you ask your doctor about testing your aluminum levels as well. Let's see, scroll down on that left side. We'll take one or two more here. What do I think about cow's milk? Depends. You know, I have cows on my farm, so I'm not opposed to it, but I'm really opposed to cow's milk in people with a newly diagnosed gluten issue, and depending on the type of milk that they're consuming, because the cow's milk from the grocery stores, in my opinion, that's not milk. It's called milk, but really what it is it's a cow under duress and under stress, being pumped full of hormones, being asked to milk 24/7. That would be the equivalent of how healthy would mother's breast milk be if mother were being forced into a quarantined area to basically pump milk all day under the influence of hormones and under the influence of foods that just cause severe obesity in that woman. That would be very unhealthy milk, and that's what I think about most cow's milk from the grocery store. Okay. Can gluten make one of the eyes start looking either bigger or smaller? It depends on what you're talking about, Dane. Without better clarity, when you say the eye being bigger or smaller, are you referring directly to the pupil dilating or contracting? Are you considering the eye, one eye is bulging, the other's not? I mean, there are different parameters to think about there. So it's, generally speaking, better clarity there might help me answer that. Okay, I think, boy, the questions are just coming and I just can't keep going, folks. I got to go home and eat. My wife's expecting me to come home at a decent hour. So thanks for sharing Monday evening with me. I hope you learned something. I hope you got some insight from tonight's show about sight and vision and gluten. And as always, hey, look, we're trying to save 100 million lives. You know our mission. And I can't do it without your help. Just like you come and you get my help every Monday night, I need you to share. I need you to share this information. If you know somebody struggling with eye problems and they're hitting a brick wall, share this video with them. Share this URL. Send this information to them. The more we share, the more we care. The more people we help, the more we can reach that mission of helping 100 million souls find their way in this very lost world of Alice in Wonderlandian-like times. So thanks for tuning in again. I wish you excellent health and a fantastic week. We'll see you next Monday night. Actually, we'll see you Wednesday night. I'll be doing a special show this Wednesday. I got a special guest. I'm not going to announce it tonight. You'll just have to show up. But you'll get an email if you're subscribed. And we got a special impromptu this Wednesday. Beyond that, I'll see you next Monday for another episode of Pick Dr. Osborne's Brain. Have a great evening. Take care. Hey, don't forget to tune in next week, same time, 6 p.m. Central Standard Time for another Pick Dr. Osborne's Brain show. Bring all your toughest health questions to me. I look forward to answering them. And before you leave today, make sure you hit subscribe. And once you do, click that bell. That bell is going to allow us to remind you right before we go live. But it's also going to allow us to remind you when we come out with other video content all week long. We've got lots of episodes coming your way all week long, and I don't want you to miss anything. So again, subscribe, hit that bell so that you can get notified when we have that new information put up for you. Thanks so much, and I'm wishing you excellent health. Have a great week. We'll see you next Monday night.